Medical professionals of Reddit, what was a time where a patient ignored you and almost died because of it? When I was in medical school, had a gentleman in his late 60s come in for chest pain. Found to have a large heart attack, very impressive STEMI in lab by EKG. Refused emergent cardiac catheterization, go through the arteries, and put a stent to open up the vessel of the heart so he could bring his car home, and planned on taking an ambulance back to the hospital. He was in the parking ramp, and it cost $20 a day to park. Came back by ambulance in full arrest, no pulse, and died. Doc had to call his son and explain what happened. He was like, yeah, that sounds like dad. He's always been cheap. Had a throat cancer patient. We offered him surgery to remove the tumor. It was a fairly conservative surgery. He left because he didn't want a mutilating surgery, and his daughter-in-law had been studying magnet therapy and she was quite good with it, his words. He came back a year later and was out of reach from any treatment. His cancer was so advanced that there was nothing we could do for him. We had a college student come into the ER and had a wonderful case of appendicitis. He needed to get surgery, as Sapper's surgery is way easier and safer if done before it ruptures. He called his parents to let them know, and they told him to refuse because he had a test upcoming in the week and they didn't want him to miss it. He left the ER against medical advice, while we were all telling him that if your appendicitis gets worse and ruptures, it can definitely lead to death. The kid luckily comes back about 10 hours later after it ruptured. He gets the emergency surgery and the amount of time he got to spend in the hospital probably doubled. Had a repeat patient, not quite frequent flyer status. As a medic, that would always call for a severe allergic reaction to shellfish every other month or so. She had always had the allergy and knew her reactions were getting worse. After a year, 6 or 7 calls of this silliness, my crew and I stayed in the hospital with her and talked at length about the situation, since she'd always stay mum about how it kept happening. She told us she comes from a patriarchal culture and her father made this amazing seafood soup. If she didn't eat it and force her body not to reject his gift to the family, she would lose her car, phone, or whatever punishment her father deemed necessary. We pleaded with her to do whatever it took to show him it was deadly and carry her EpiPens with her. Fast forward a few years, when I altered course into nursing and joined that saw a familiar bloated face. Turns out she had gone off to college in another state and hadn't been home for a while, but had visited her folks for a holiday. Of course she had the soup, and despite hitting herself with the EpiPen when her throat started tightening, the reaction continued. Her mom, who I had never seen before, told me she tried to eat it fast and rushed to the bathroom, where she was found on the floor. Medics couldn't tube her in the field, so tried medical management until they could drive her to our doc performed a tracheotomy at the bedside and she went to the ICU. Took a week for her to recover, and I was told by the ICU nurses that her father finally got it, that her allergy was a real medical condition. I've read that the most common reason for a surgery to be reperformed is the patient not following doctor's orders during recovery. Doctor says, don't ride your bicycle for 6 weeks. Patient hears, don't ride your bicycle until you feel you can. Didn't die, but did lose an eye as a result. Young kid, 20, with bad diabetic retinopathy from uncontrolled DM type 1. Had eye surgery to remove blood and scar tissue from inside the eye. We told him to take it easy for a few weeks. He went to 6 Flags. Roller coasters are bad. Retina completely detached. Eye got soft and painful, had to be removed. Not a med professional, but my aunt is, and I'd like to share her horrifying story. She once had a patient, young guy in his early 20s, who had very poor hygiene. Didn't shower regularly, didn't brush his teeth, wore the same clothes for days on end, etc. He one day came in with a nasty rash on his lower abdomen/pubic area that was starting to show signs of infection. She provided antibiotics and instruction and extensively stressed to him to improve hygiene and keep the area clean, otherwise it'll just keep coming back or get worse. Well, as the story goes, he didn't pick up the prescription and apparently chose to just keep putting R&D gold ointment on the area. She later found out he ended up in the ER after going into shock at work. Turns out he ended up getting gangrene in the area and it had spread to his penis and scrotum, which had to be removed. My dad tells a story of a morbidly obese woman who came into his clinic and after an exam told her simply, if you don't make drastic changes to your lifestyle and diet and start losing weight you are going to die. She was dead within the week. Her family tried to sue because my dad was clearly a witch doctor and cursed her to death. It was sad all around. I'm a nurse, and I had a very polite and lovely patient trying to remove all manner of chest tubes and dives after a motorcycle accident. He was obviously delirious from the pain meds and the head injury, but very nice still. I left him in the care of my coworker for my lunch. 10 minimums into my lunch break I see him stagger past the break room door like something out of The Walking Dead, trailing blood everywhere, only to collapse out cold a couple of seconds later. Said he needed the bathroom. IDK how the fuck he pulled his own chest tubes out. Removing them always makes me cringe, let alone doing it to himself. He was put back to bed, this time in the ICU, and got some more sedation, and even though him ripping it all out set him back a couple of weeks, he still discharged and came to say hi and thanks on the way out. The happiest delirious patient I ever had. What a bloody trooper. Haha. We had a mom in the NICU who would constantly kiss her premature baby on the mouth. Several nurses educated her around why that's not safe for the baby and thankfully documented their teachings. This was during cold and flu season and became even more concerning when the mother was coming in with cold-like symptoms, coughing, sneezing and obvious congestion. She still continued to kiss the baby right on the mouth. The baby was almost ready to go home by this time, but got extremely sick. The baby ended up on a ventilator and had quite the extended stay with many close calls. It happened so often it was almost a non-issue. We would basically just shrug our shoulders and say, well. I had a patient who kept adjusting her insulin dosage against my advice because she was terrified of having her feet amputated like her mom. So she had several occasions of dangerously low blood sugar, one of which put her in the ICU. Had a lady who had the opposite problem, raging diabetes but in deep denial. So she would never take her insulin. So she was in the ICU multiple times for the diabetic ketoacidosis. Had a ton of patients on dialysis who skipped dialysis for whatever fucking reason. Didn't feel like going. Had a fight with boyfriend, who was her ride. Took a vacation to a city without a dialysis unit, etc. So they would come in with their electrolytes all fucked and had to get emergency dialysis inpatient. Had a billion old fat men with chest pain for weeks refused to come into the hospital to be evaluated for cardiovascular issues and either die at home or come back a week later with extensive miss. Half of my patients with COPD were still active smokers despite my exhortations. One had burnt scars over a third of his body from the last time he smoked around his O2 tank. Had patients take extra doses of benzodiazepines, Xanax, Valium, etc. and end up in the hospital with overdoses. Not necessarily the patient, but the caretakers at the facility where the patient was living. I used to visit different board and lodge facilities for adults with mental illnesses and meet with clients to discuss their mental health, help them set up job interviews, therapy sessions, and help them set up their medications for the week if they were unable to do it themselves. Most of these facilities were places for people who had left the hospital and were deemed independent and stable enough to have the freedom to come and go as they pleased in a shared living situation, much like a dorm. Despite having a place to stay and food provided, they were usually pretty poorly supervised by the mental health staff workers there. I often hated these places because, while they were ideal for some people who were truly getting back on their feet and thrived off being able to live a semi-normal independent life, they were way too lax for many of the sicker, more isolating patients who were not at all well and slipping under the radar. Some of this included them not taking their medication as directed, which was one of the requirements for keeping their housing, but unfortunately it was not strictly enforced. There was one man who had paranoid schizophrenia who was extremely quiet and kept to himself. I had met with him a few times and he seemed to be going downhill in his appearance and general mood. I spoke with his doctor and urged the facility staff to closely monitor him and his medication intake, as I saw in his logs that he often skipped coming in to get his medication at all. I was told that they were going to be sitting down with him to remind him of his living agreement and that he had 30 days before losing his housing if he wasn't med compliant. I was also told that his psychiatrist was aware and they may be sending him back to the hospital that week. Apparently this never happened, and he went out into the community and acquired a knife and used it to slice up his roommate while his roommate slept. He carved him from mouth to ear and stabbed him in the stomach several times. The man survived the attack, but the man who had gone off his medication claimed he was being poisoned by his roommate through the window unit. For anyone with a violent incident like that on their medical report, it is incredibly unlikely he will ever be able to find a better rehabilitation house ever again that will accept him. The system basically screwed over 2 people that day, as the man who was hurt was already there for PTSD, and as you can imagine, it not only scarred him physically for life, but exacerbated his illness with more trauma. Some related posts from older threads. /u/Stattery said here. Doctor in training, have already had 3 children die during my pediatric rotation from preventable diseases and their complications. Parents opted out of vaccination. All 3 pairs regretted it after the death. It's become harder for me to have polite discussions about immunization because the conspiracy theories about vaccines are killing children. I get so furious every time it comes up. /u/Schweit said here. If you have old people in your house, or you are regularly in the house of an old person, pay attention to, and get rid of, small area rugs, carpet runners, etc. They are terrible trip hazards, and a broken hip is generally the beginning of the end for anyone over the age of 70. /u/Juggernaut_thoughts said here. I work as a nurse in a hospital and I can tell you that the best way to prevent COPD is by just not smoking. Jesus Christ, it is a terrible way to live out the rest of your life, where every breath is a literal gasp for air. My granda is a patient. Come straight back if you have any chest pain. He didn't go back and this is what followed. Blood clot traveled to his brain. 3 strokes. Bleeding on the brain. 2 more minor strokes. Paralyzed left arm and right foot. Broca's aphasia. He went from being a man nearing his 80s who was old school. He worked as a school crossing guard, grew all of his own vegetables, fed the birds, built tables, biked 6 miles on the weekends, walked everywhere, and was still able to play darts despite his eyesight being that of a visually impaired gnat, because he knew the board so well. He went from that to living in a care home, and unable to talk. Has he lost his stubbornness? Nope. He won't do his rehabilitation, and so even though he could get his speech back to a decent degree, he doesn't want to do the therapy, and using communication cards humiliates him. So we are left trying to decipher under micro movements, so we can guess what he's trying to say. One of these days, I swear on my own bloody eyelashes, that I'm going to shake him until his teeth rattle. Him and his brothers, they're all the bloody same. My uncle, Granda's younger brother, didn't go to hospital at all, and was found on his bedroom floor, whimpering. He had flipping sepsis. I'm not a medical professional, but I used to get allergy injections to build up my immune system because of the crazy amount of allergies I had. I would get these injections every week, and I was instructed by my family doctor and the allergist to wait in the waiting room 30 minutes after the injection in case I received a reaction. Well, one day I decided I didn't want to wait anymore, also because it had been a few months without a reaction, and left immediately after my appointment. I went into anaphylactic shock not even 10 minutes later. It was crazy, because I didn't even know what was happening at first, and didn't even know how to use an EpiPen. I was assistant manager of a group home. We had a resident who had epilepsy, and was also very reclusive. He would get agitated if we came in his room or even knocked on the door. However, policy said he had to be checked on every 30 minutes because of his seizure risk. That wasn't being done, so I brought this up to the manager. She said she was aware, but it was okay to bend the rules because he would get really upset when we checked in on him. I really wasn't comfortable with her answer, but I was young and assumed she knew better than me. When I was on duty I checked on him every 30 minutes and he would yell at me, but I didn't let it bother me. About 6 months later, after I had been reassigned to another group home, he had a seizure alone in his room and was found dead a day later. Now I'm older and a little smarter. When I find a problem like this, I stick with it and don't let people talk me out of it. Not again. Rest in peace, D. Gone but not forgotten. Patient was supposed to have starved for 8 hours for her morning scheduled breast surgery. During the procedure she regurgitated what can only be described as a full partially digested English breakfast with identifiable sausages, egg, beans and possibly black pudding up into her unprotected airway and attempted to inhale the lot. Managed to prevent the majority of it going down, but she needed HDU care for a day or so for her lungs to recover from the stomach acid. Me. Didn't almost die, but I was very sick. I went for a mini vacation in Batam, Indonesia where our villa had a private pool. Throughout our 48-hour stay, I spent more time in the water than out. The time I wasn't in the water, I was in our air-conditioned villa room with just a t-shirt, now damp, over my swimsuit. In the day it was blazing hot, and at night it was super windy, because it was near the sea. I'm also asthmatic. While it's mostly under control, I usually get a tight chest feeling when I'm ill, and haven't had a full attack in years. I fell sick after the trip, high fever, runny nose, cough. I'm also a healthcare professional. I studied life sciences and diagnostic testing. I'm hardly bothered, and can take care of myself when I get sick. Eventually the fever went away, and I was left with a cough. The week after the vacation, I was still having a cough, and we went to play paintball. Completely overexerted myself running, ducking, crawling, what have you. After the game, we went to a friend's place to have lunch and chill. I fell asleep, but woke up coughing with the feeling of something being stuck in my respiratory tract. I thought it was phlegm. Went to the bathroom to cough it out, but nothing was happening. I lost track of time and apparently I was in the bathroom coughing away for about 30 minutes. Friends asked if I was alright, and I just kept saying yeah, it's just a cough. I think there's some phlegm stuck, and I'm trying to get it out. Finally went to see the doctor, my regular GP, the next day. Turns out I was having a very serious asthma attack. I just couldn't recognize it, because I hadn't had one in many years. Worst thing is this was the same doctor who told me to always carry my inhaler around just in case, but I just wasn't diligent about it. Until now, my friends would yell it's just a cough, I'm fine, whenever I make even the smallest cough or sneeze. Now that I think about it, I actually could have died.